So we're here at the Medical Equipment Loan Program Warehouse, which is located at 1063 East San Carlos Avenue in San Carlos. And Dee Dee Clark, an occupational therapist, is going to give us a discussion of some common equipment that is used in the restroom. We call it toilet talk. Thank you, Dee Dee.
Yeah. Well, thank you for having me. I know this is our second series of these workshops, and I was thinking about when Scott and I started talking about doing a couple of workshops, we realized how much equipment is in this warehouse, and it's impossible, of course, to go over all of it, but last time we got together, we went over the mobility equipment, and then today we're going to go over bathroom safety equipment. So thanks for having me back, and two things I want to just touch on again, like last time. First of all, the importance and the amazing program that you guys have put together. My job as an occupational therapist is to keep people safe and independent in their own homes as long as possible, with the focus on fall prevention. And what you guys do in this program is give out equipment that keep people from falling, keep them safe, keep them independent, and I really believe it's preventing a lot of injuries along the way. So thank you so much for putting this program together. It's amazing. And the other thing I wanted just to reiterate and to weave into our talk today is kind of the language that we use when we're talking to the borrowers. Remembering that we're not here to recommend anything or to tell people what they need, because we don't know what their medical status really is. We don't know what their home situation and their actual home environment looks like, and we don't know their background. So it's up to them and their doctors and their therapists to figure out really what they need, but it's up to us to provide them with some choices and to educate them on the features of what we have here so that they can make a good decision on what they need. But definitely don't say, I recommend this for you, because they could go home, use the equipment, they could fall at home, and then they could come back to us and say, well, you recommended this. So as long as we're using the right language, I think it's great. With a focus on education about the equipment. So the first thing that, one day I was here and Chris said, I heard about your presentation and I'm dubbing it as toilet talk. And I liked that. So we're gonna call this toilet talk, but we're today gonna talk a lot about toilets, but also about showers and bathtubs. So that's kind of our agenda. And my first question is, how do I phrase this? Why is it important that we talk about safety in the bathroom?
Because it's where the tile is and you can slip if it's wet.
Yeah, highest percentage of slip and falls, I would guess.
Yes, such a high percentage of slip and falls. I meant to look up the statistics, but they're very high as far as number of falls in bathrooms. And the consequences are great when you fall in the bathroom, because usually your floors are tile or something hard, as opposed to falling in the bedroom where maybe you have padded carpet.
Plus there's a lot of irregular surfaces in the bathroom to hit your head on.
Right, a lot of porcelain, tile, a lot of rugs, little area rugs that people trip on. People love their little area rugs. And a lot of different places that you might need to step up and over into the shower or maneuver. The advantage actually of a bathroom is that usually they're smaller areas and there's usually sinks and things to hold on to. So there are some advantages to a bathroom. So what I thought we would do is I pulled a whole bunch of toilet related equipment, and I pulled a whole bunch of shower related equipment. So we'll just kind of go down the line. There was so much here to pull from. I could have, extended this all the way down the warehouse, but I tried to pick the most common things with different features in them. So we'll start with toilets. My next question is, why do people fall specifically related to toilets, especially at night going from the bed to the toilet?
Well, it might be dark for one.
Yep.
They've just gotten up and may have lower blood pressure and lose their balance.
Yep.
What else?
And the toilet represents a change in height from a standing to a sitting, so that's a change in position. That's tough to do.
Yep.
Or for some it is.
Yep. And the other one that comes to mind is there's an urgency. So usually you're sleeping and then something in your body tells you you have to go to the bathroom, and then you slowly wake up, and then you're like, I have to go to the bathroom now. And so you're going from laying down to sitting up. You're getting dizzy, possibly from changing positions. You're disoriented because you were just asleep, and you feel like you have to get to the bathroom quickly. So all of these things combined lead to falls going from bed to toilet. So I oftentimes look at that pathway and make sure that there's lighting on the way to the toilet, either motion sensitive night lights or just leave a light on in the bathroom, whatever their situation is. But I gotta get them to the bathroom safely, or we have to consider putting a commode chair right next to the bed. People hate commode chairs next to their bed for obvious reasons. But one thing I thought of is when somebody comes in and they ask for a commode chair, you say, do you want one commode chair or two commode chairs? Because one next to the bed, one over the toilet. So during the day, they're using the one right over the toilet, and at night they're using the one next to the bed. So they have both options depending on how they're feeling. Okay, so this is the first commode chair that I pulled, and I pulled it specifically because it's very low quality. And I realized this one day when I sat in it myself, and it feels like you're just gonna sink into, it's just very flimsy. And so if you guys get a chance, try it today. Try sitting on the different ones, because there's definitely a difference in stability and quality. And I just thought if I had to sit on this for a long time, it would be super uncomfortable. So if you're grabbing a commode chair for somebody and you have the choice between commode chairs, you can see that this one's a little bit more stable. It's not a ton more comfortable, but there's definitely a decreased comfort in commode chairs. The features of these two are, first of all, the height. So you're gonna probably, commode chairs in general are the easiest way to give people increased height in their toilets, and also the bars to be able to use the handles to stand up and sit down. That you want to make sure that people know that they can be adjusted. I know that you guys all know that already. It's amazing how many people don't realize that there's an adjustable feature. So make sure to tell them to adjust it. You can even help them if they're here in person. What I do is I start, I know what I was gonna say. I start at 90 degrees of the knee, but possibly they're gonna wanna go a little bit higher just to make it easier. So what type of disability would lead to somebody to need a commode chair, or somebody to want a toilet with higher height? So like a knee surgery or a hip surgery. Usually doctors after hip surgery say that you can't bend more than 90 degrees at the hips. So they're supposed to be sitting up a little bit higher. Arthritis in the knees, and any balance problems that makes it, harder to get up and find their balance. So definitely adjust for height. I know you guys are really good about the buckets. So make sure they have a bucket. Try out those buckets on the commode chairs just to make sure that they fit, because sometimes they're odd sizes. And then just to go over the things that you have here. This is supposed to be a splash guard. So if a person is standing in front or sitting, it's supposed to keep everything going into the toilet. So usually somebody's going to use the splash guard. The bucket is used next to the bed, and the liners can be ordered on Amazon or online, but often, like this is a box of liners that I just found yesterday, you guys often have them. So if somebody comes in and they want a commode chair, give them try to grab them the most stable one, show it to them, tell them the features, make sure they have a bucket, a splash guard, and then maybe offer them some liners if you guys have some in stock. Or tell them there's also liners, you know, if you want to order them on Amazon, they just make the cleanup a little bit easier. Also, they have, some of the buckets have the tops on them. The tricky part is moving the bucket from the bed possibly to the toilet to clean it for somebody who has balance problems. I kind of wish that the lids were a little bit more secure in case they drop it, but there are lids to some of the buckets too. A lot of the people I work with are in wheelchairs and have had maybe a stroke or a spinal cord injury, and they need to transfer from their wheelchair to the commode chair. And so they don't have the ability to stand up and get over this handle. So I like these because of the drop down handles. And then what they can do is they can just slide over. So this one's nice because it's actually extra super stable. Also, it's padded as opposed to these, so it's more comfortable and super stable. This one I pulled just to let you know that, you know, they're different widths for different sized people. This one also has the drop down. So this would be for a bigger person. Also super uncomfortable, by the way. And this was the last one that I pulled out. This is a rolling commode chair. This one is nice, depending on the situation. You could sit on it with the pad or take it off and it would be the toilet. This one I would use with somebody who's a little bit more limited in their function. And wanting to be really efficient in their morning routine. Usually they would have a caregiver. I have a lady right now I work with in Pacifica. She uses one of these. She's had a stroke. And what the caregiver does is she puts it right by her bed. So the caregiver comes in the morning and the client is in bed, puts it next to the bed. Helps her transfer out of bed into the commode chair with the arm up, brakes on. After she is in the commode chair, she pushes her over to the toilet. She does her business on the toilet, and then she pushes her straight into the shower. And they've modified the shower with a little ramp and a platform. So she goes bed to toilet to shower and then into her wheelchair. So this one's really versatile for certain situations where somebody needs assistance moving from place to place. Okay, so I'm gonna move from commode chairs to other toilet devices. Sometimes somebody will come in and they'll say, I need to raise my toilet, but for whatever reason, they don't want a commode chair. So we have some options, and the options have some pros and cons. this is one option. We were kind of in agreement that these, I don't know exactly what they're called, in agreement that these are not the safest option to raise a toilet.
We call them toilet risers with handles. I don't know
Toilet
what they're
risers with
really
handles.
called.
That's probably the best way to describe them. I get a little bit nervous about those staying on the toilets, and they're a little bit tricky because you can give them to someone and we don't really know if they're going to fit their specific toilet. So I'm hesitant usually to install or recommend these.
And we also have them without handles.
And some are without handles, yeah. These two don't give extra height to a toilet, but they give the handles. This one is bolted to the back of a toilet seat, and then this one is not bolted to the back of a toilet seat. There's pros and cons. So this one is not bolted, so it moves around more easily, and the suction could or could not hold in the back, but it doesn't require any installation. This one is a little bit more stable because it's bolted, but it requires the installation in the back. So you have to make sure that if somebody is, looking at borrowing this piece of equipment, that they are competent and they have the skills to bolt the equipment down and keep it bolted over time, because oftentimes bolts come loose. Do you want?
I have a question. Professionally, would you recommend a toilet frame for that purpose, or would you recommend a commode where you've kind of not using the bucket feature?
So at this point in time, I am more likely to recommend commode chairs because they're simple. They give the stability, they give the handle, they give the height, they kind of give everything. And if it's not working for some reason, then maybe we try something else.
Because our clients often go just the opposite. They don't, I think the idea of using that implies a more serious situation. Whereas this is like, well, I just need a little help. So people will say no commode, I want a toilet frame, but you would actually recommend that they use a commode for safety purposes more than the toilet frame?
Well, that's a good point. I would also listen to them in that comment and understand that that is a true concern for people, that if they're not at the point of, accepting the need for something that looks very medical, and they are going to prefer something a little bit less high profile, then definitely I would listen to that and try to accommodate them. Yeah. So now we're going to talk about items related to the tubs and showers. So why do people fall in the shower? Show this to the camera. I didn't see these in stock at the moment, but I know you often get these. I really do like these. They're pretty stable. You've seen them here before.
Oh yeah, we
They're
have
pretty-
them, but we don't have them as
At the
often
moment.
as we have them.
Yeah. And the reason I do like these, if somebody's using a walker or a cane and they're in a small space, sometimes with a device like this, the leg down here kind of gets in the way of their walker. And so this sometimes just allows, it's a little bit less lower profile, and it allows their walker or their cane to get around. Okay. Questions about toilets? Or eyes closed, because if you think about it, when you're washing your hair, when you're shampooing your hair, and when you're rinsing your hair, you close your eyes. When you close your eyes, you get disoriented and you're more likely to fall. So if anyone is at all possibly unsafe standing in the shower, I like to at least give them a seat that they can sit on. And it doesn't mean, this is also hard for people to accept, a seat in the shower. But I explained to them they don't have to sit the whole time. They can still stand and sit. And I especially encourage them to sit when they're washing their hair, when they're rinsing their hair, and when they're washing their feet. Because people try to do all kinds of things to wash their feet, and it's just a recipe for falling. So I try to say to them, you can still stand, but for part of the shower, I'd like you to sit down for safety. So if somebody is at risk of falling in the shower, usually my go-tos are some sort of chair or seat, grab bars, making sure their tub or shower is non-slip on the bottom with a mat or some sort of texturing, a mat or a carpet with a non-slip outside the shower, and sometimes also a handheld shower hose that can also be secured in front of them at a low level or at a high level. And actually I found some shower hoses up here yesterday. I took one. Okay, so we'll go through chairs and benches really quickly. These three I consider tub chairs, and then these two I consider tub benches, just for language. Again, adjust them 90 degrees at the hips or a little bit higher if they need it to be easier to stand. Also, when you go higher, you lose a little bit of stability. So you have to figure out that magic point. So you can educate them about that. Obvious features: small, no back, no handles. Small with a back, no handles. Small with a back and handles. So giving them a choice. If they come in and say they need a tub chair, do you need a back, do you need handles? You might show them these three and let them choose. Because they won't know what the options are, maybe. Okay, so now I wanted to spend a moment on the tub benches because there's a couple of important features in the tub benches. If somebody has a bathtub shower, then what's gonna happen is, so let me back up. If somebody has a tub, they could put a chair inside the tub and it would maintain the ability to have sliding doors.
Mm-hmm.
If they're gonna use a bench, they have to take off the sliding doors because this part is gonna stick out of the shower. And I think I have a photo that you guys can just look at. So you can see if you're gonna use a bench in a tub, you have to take off the sliding doors and put up a curtain. So you might need to add a rod, or you might be able to hang a curtain from the top bar there. But what people don't know is that they have to have the right orientation of the tub bench.
You want to show the camera?
Sure.
And of course, I was surprised that your annotation is that the handle is on the wall side.
Right, right. But you can understand why, right?
Can't get in.
You can't, otherwise it blocks you from getting in.
Right.
So if somebody comes in and they ask for a tub chair, a tub bench. I like the tub benches because they're so sturdy. I'll even put these in a shower, not only in a bathtub if they have room in their shower. But what they're gonna be able to do is they're gonna be able to, so I'm not articulating this correctly. The tub is gonna be this way and the water's gonna be coming out here, and this handle is gonna be toward the wall. Because you want them to be able to come, approach it, turn and sit on it. Now you know they're safe. Now they need to just get their feet over. If they have a tub chair in the bathtub, they have to do this kind of thing to get in. And if they can't do that safely, just think of how, and maybe they don't have a grab bar, maybe they're holding on to whatever they can. This is so much balance required and a lot of hip strength, hip flexor strength. So that becomes very unsafe. So I love the tub benches.
We also have longer versions of this.
Yes.
And we have some that slide.
And the sliding ones. One of my OT friends uses the sliding ones a lot, and she's gotten used to using those. I have noticed that they just stick out into the bathroom quite a bit, and so they take up a little bit more space, and they're a little tricky to, but I want to make sure everybody knows that almost all of these change sides, and the borrowers won't know this, but you slide them out. And you turn it around. So you slide it back in here. So that's the most important thing with the bath bench, is that we explain to them that they have to be the right orientation. Okay. I just pulled a couple of more things. This is a grab bar that I've installed recently, and I actually feel like it's a pretty safe, easy to install gadget. It goes on the lip of a bathtub, and it's easy to tighten, but I always tell the borrower or the client to make sure that they check it and that it stays tight over time. I pulled this grab bar just to demonstrate that it has like a texture to it. So if you're installing a grab bar, if somebody comes in and asks for a grab bar, you say, is it for a shower or a wet situation? And if so, if you have a grab bar with some texture to it, that will give them a little bit more stability if their hands are wet and soapy. Okay, and my last gadget. Does anybody know, this is something I actually really like, but does anybody know kind of what scenario this would be used? I would use this for somebody who wants to do their grooming at the sink in their bathroom. If they're in a wheelchair, they're pretty low and it's really hard to see in the mirror and it's hard to spit into the sink. So I would have them either if they're walking, they just walk in and I have this placed in front of their bathroom sink. And then they're up higher and they're also engaging, their legs while they're doing whatever they're doing. So I like that from a therapy point of view. Or in the kitchen, you can put it in the kitchen and then it gives them a higher space for them to be doing their meal preps. So it's just a safe, higher chair for somebody who might not be able to stand for a long time, but still wants to be engaged in some activities safely. So this is another one I use in the bathroom a lot.
Dee Dee, thank you for a very thorough review of bathroom equipment, safety equipment, much appreciated. And we'll stay and ask a few questions even after we're done here.
Great.
Thank you.